The FDA urges consumers to steer clear of off-brand versions of the popular weight loss drugs Ozempic and Wegovy. Dr. Jessica Bartfield works at the Weight Management Center at Atrium Health Wake Forest Baptist. She says the high cost and short supply of these drugs cause many people to turn to compounding pharmacies.
And the problem is that when drugs are compounded, certain ingredients may be added, the medication can be diluted. They're not using the base medication that has been studied and FDA approved for safety and efficacy.
Semaglutide is an active ingredient in both Ozempic and Wegovy. The FDA warns compounded versions of semaglutide, often sold online, have not been approved for use in people.
When potential ingredients may be added or it changes kind of the form that it was studied for safety, we don't know the safety risks. And particularly when patients are on other medications, you have a risk of just unknown side effects, or you have a risk of even interactions with other medications that you should be taking.
As of May, Ozempic and Wegovy remain on the FDA's list of drug shortages. If a patient is struggling to access these drugs, Dr. Bartfield recommends they talk with their doctor to find a safe alternative until supply is no longer scarce. So it's really important that people heed this warning. The FDA is urging them not to go to these off-brand drugs because they are easy to find online, but like they said, it's not FDA approved.
Yeah, and I think many people understand that, but then it's another issue with just the cost of prescription drugs.
Yes, yes.
I mean, if you can get something for a fraction of the price that you can get it somewhere else with more risk, I could see why people want to do this to get the results that they're looking for.
Especially when it comes to these drugs, like for example, Ozempic, for example, without insurance, we're talking about $1,200, $1,300 a pop, which is very, very expensive. And usually to get that insurance to cover it, you got to get a doctor's prescription. So some people don't get a doctor's prescription. They're going to try to go online and take some of these shortcuts that might not be safe for them.
Right, and then you're kind of left weighing the risks versus the rewards, and everybody will just make their own decision based on what they're hoping for, which is more, I guess, beneficial to them.
Long story short, don't do it. Doctors say don't do it.